PIO wanted to ask if, oh, you're recording. We would
Yes.
love to get the recording. There might be snippets of this that we include. We try and use our time efficiently. If I say something that they want to put up on Facebook, then they can use it. So it's lovely to be with all of you this morning. And I love talking with students. I actually pretty regularly meet with students of various ages to talk about public health and also talk about like career development and career paths. And I appreciate all of your questions. Some of your questions have answers that could take me the entire 45 minutes to respond to. So I have looked through and identified a few that I think will lead us down a good pathway this morning. I think starting off with just who I am, I have worked in public health for over 20 years now. I have a degree in dietetics, which is basically the science of nutrition, and dietetics has a big, broad scope to it. The biochemistry of metabolism, all the way to the sociology of how people behave and those impacts on behavior, how we put policies in place to support public health and obesity prevention, hypertension, diabetes prevention. And that's really my area of expertise. And so I spent about 15 years of my career doing strictly things related to obesity and chronic disease prevention related to diet and nutrition. And then was asked to apply for a position in Fresno County Public Health. And at that time, I really didn't know what public health departments did. But they wanted me to step into a role that really managed multiple programs, all related to chronic disease prevention, but not necessarily all about diet. Although diet is a big part of it, it's also physical activity, but smoking and other like policy and systems change kind of work that kind of create an environment for healthy living. And so one of the questions was, what's the hardest part of your job? And I think there are lots of answers to that question. Right now, one of the things that's difficult is that public health has this big, broad scope of things that we do. And I encourage you to go to our website and look up the vision and mission. It's on our website. You can find it pretty easily. And you'll be able to see in the vision that the scope of what we work on is really quite broad. We work on safe neighborhoods, we work on clean environment, we work on economic vitality and lots of different functions in addition to communicable disease. And so right now we're focusing a lot of our efforts because it's an urgent situation for us to attend to and to really manage well. And I think the hardest part right now is people's real misunderstanding of public health. And we're really the people who are advocating for more people to have job opportunities, to expanding opportunities for populations who are experiencing inequities and things like that. And so many of the comments and things that are made in the public about public health not caring about people being out of work and things like that is really so far from being true. And we're not able to really counter that mindset other than to just do our job well and to do everything that we can to address inequities in even the experiences people are having around the COVID response, but also to work as hard as we can to safely get people back to work and back to living wages as we are able. So all of that is science driven. I think the other part that's difficult about what we're working on right now is we are also people. And so we really do understand so much of what people are upset and having a hard time with. My own father is in his 70s and has compromised lungs. So I'm experiencing my own fears and anxiety about potential exposure of my loved one. And my husband as well, he used to be a smoke jumper, so he has compromised lungs. And so we have those stressors, friends who have lost their businesses, and we're all touched by this. And so we have to kind of bear that anxiety and that burden that we have for our own lives and for the people that we know and love and care about, while also bearing the burden of the the entire event and how we actually manage that event and the anxieties and fears that other people experience. How do we help them manage those as well? And it's a tougher, it's not an easy job right now. But I personally feel to have a responsibility to community and to do our very best and to help an amazing team of people. We have so many people who are working on this to have the best outcomes that we can and to be as proactive about what we do as possible. And Madera is really doing a great job, and it's being noticed across the state in terms of our contact tracing and efforts that we're making. I wanted to just talk about, someone asked, what have you done differently to protect your family at this time? And what I can honestly say is that the principles for protecting my family and the principles for protecting your family are exactly the same. And someone asked, what are you going to do differently when we come out of quarantine? The answer is the principles are the same. Whether we're at shelter at home, whether other non-essential businesses get opened, it's still exactly the same principles. We're applying them in my family. We're encouraging you to apply them in yours, and that's staying 6 feet apart from each other. And there are lots of different methods for doing that. There's actually standing apart, but there's also creating physical barriers between people. Like in different businesses, people are putting up plexiglass and things like that to create physical barrier because the virus transmits through droplets. And so if you can create a physical barrier, then that is a good method of reducing transmission. People working from home, even once we're out of shelter and home, it's still a good idea for many people to still continue to work at home and to meet virtually and through video conferencing and things until we know that we have more herd immunity and that we have a vaccination in process, that we have antibody testing to give us more science about what's out there. We need to practice these same things no matter what the external rules might be. And so that's been our approach in Madera, is really educating and helping people understand the power that they have as individuals to make their own individual choices for having that physical distancing. Of course, all of the standards that you've heard, like hand washing and taking things outdoors where possible because you have better airflow and so it's less likely for people to transmit. If you are able to wear a face covering, what it does is it protects the other people from you if you're wearing the face covering. It does not protect you from others. And so because we know that there's asymptomatic spread at this point, face coverings can protect the people around you. Doing screenings in areas where people are gathering together, disinfecting surfaces, gloves, all of these tools are things that we're using in my family, and I encourage you to use in yours as well. The one question, how long do COVID-19 systems usually last? The answer to that question is that it varies. It depends from person to person. We have people who contract the illness and never experience any symptoms at all. And then we have other people who experience mild symptoms. We have people who experience very severe symptoms. And so the duration of those symptoms often correlate with the severity of the illness that they experience. How do you distinguish pneumonia from COVID-19? So pneumonia is actually, it's a symptom. So just like runny nose or a headache or something like that, pneumonia is actually a symptom of lots of different diseases that affect your lungs. And so COVID-19 often affects your lungs and can include pneumonia, which means that there's an infection of some kind, there's a virus or bacteria or something in your lungs. That's what pneumonia means. And so someone who has the might have pneumonia. As COVID-19 might have pneumonia. Someone who has asthma might get pneumonia. So I hope that clears that up. How many people have been infected by the virus? That's something that we don't have enough data to report. We have confirmed cases based on testing, but there are a lot of people out there that we know that have been infected that don't have symptoms. And so what recent studies have shown in California is that we expect that the infection rate is about 5%, and that includes asymptomatic folks. When COVID-19 patients go to the hospital, do they stay in special rooms so they do not affect other people in the hospital? Yes. They're called isolation rooms and often called negative pressure rooms, and that means that the airflow in that room stays in that room and does not go other places in the system. And so right now we're able to keep those ICU rooms for COVID patients. And what the hospitals have are these surge plans. So they have the ideal, which is where we're at right now in terms of number of patients. And then they have plans for what's the next tier of where would we put COVID patients then, and where would we put the next tier of COVID patients. And based on symptoms and how transmissible they might be, like if their symptoms are pretty mild, and they're not like actively coughing all over everyone and that kind of thing, or they're not needing a ventilator, then they would probably be placed in a different part of the hospital than somebody who needs the more urgent care or ICU care. And so the hospital has actually completely transformed how they're doing business, and they have COVID in just one part of the hospital, and they actually have color-coded pathways, and only on this color are COVID patients allowed to be transported so that they're kept separate from other people. And Madera Community Hospital is doing an excellent job in terms of their planning and management of COVID patients. We are all concerned about limited testing, and what is Madera doing to advocate for more testing supplies in hospitals? So we're advocating very, very strongly on both fronts. So supplies in the hospitals includes lots of different things, including protective equipment or PPE that you've heard a lot about, but also ventilators, gowns. Healthcare personnel is actually a supply that we will need if we get to a place of surge. And so there's a state system of requesting all of those resources, but then we also locally source as much as we can find. We have a person that it's their entire job to go and find those supplies, and compare pricing and all of that kind of stuff, and find out how we can get it. In terms of testing, there are several fronts we've been advocating. Part of it is just finding tests that we can go and purchase, which we have, and lab space to be able to do that. But we also have a new state-of-the-art public health laboratory in our new facility. And so we have a machine that we typically use for chlamydia testing and gonorrhea testing. It's called the Gene Expert. And the company that makes that machine and does the cartridges developed a cartridge that was approved by FDA on the 23rd of March. From the 24th of March, I have been bombarding that company to get cartridges for our public health lab. And it's been an uphill battle because we're a smaller county and they're a business that obviously would be profit driven. And so we have after a month, we're getting cartridges machine. We're excited about that because it has a 45-minute turnaround. By the time you put in the specimen, run the test, it'll be an hour and we'll have a test result. So if we have, for instance, a paramedic who works in our ambulance service that potentially has been exposed, we would want to test on them immediately to know what they need to do, and if they need to be pulled off of their post or if they can continue doing their job. And so we definitely we're going to be using those tests for those important cases where we need very quick turnaround. We don't have, so there are a lot of questions in here about timeline. When are we going to get a vaccine treatment for COVID? And I have a special tool for questions like that. It sits on my desk. It was given to me for my birthday after I'd been at the health department for a month. And we're going to see how long it's going to be before will we have a vaccine by September? Cannot predict now. That's accurate. There are a couple other questions that are like that. Is the projected peak timeline known? When are we going to peak? So are we going to peak in May? Let's see. Very doubtful. I think that's accurate. Are we going to peak in 4th of July? My sources say no. The truth of it is, And I'm being funny, but that's kind of where we're at with a lot of these things. And I don't want to say that we don't have science and we're not working towards as much knowledge as we possibly can. I think that in our culture, we are used to, I wonder if, why the sky is blue. And I get on my phone and I Google it, and then I have an answer, and it's right there, and I have it right now. And with this virus, it's actually, for all of history, the most studied virus in such a short period of time. And we are learning things all the time. And because we're learning things at such an accelerated pace, I think people forget that just 2 weeks ago, we didn't know that there was asymptomatic spread. That was only 2 weeks ago. And now we know it in a way that we think, oh yeah, we all know that. And so there are lots of things that people are asking public health, and really we have modeling, and our modeling shows the way things would go if we do no mitigation. We have modeling for things that how they would go if we did lots of mitigation. Right now, we have way flattened that curve in terms of a peak with the shelter at home order in California, but we don't know what's going to happen to that curve when we start opening non-essential businesses. A lot of it is based on how compliant people are with the principles and the guidelines that we put out. And without any way to predict that, we have to prepare for kind of lots of different scenarios. We need to be prepared for a surge at any time. We're going to be watching the trends to see if we're moving into a curve of a surge. And that's when we do things like activate our alternate care site, where we have extra cots and medical supplies and things to be able to do more hospital-like beds, but lower level care that are not acute. And so we have plans, and we're prepared for how that will lay out. But exactly dates and times are dependent on so many variables that are outside of our control. They're honestly largely in your control. So the governor, as he lifts shelter at place, we're going to be putting things in place, but we're going to be depending a lot on the community to follow the principles that we've laid out, and hope that through our own individual efforts, we're collectively protecting the most vulnerable in our community. Let's see, where are we at on time? Oh, we're good. I can do lots more questions. I might open it up and let you ask some on the spot ones too. Confirmed cases of COVID-19 in Madera County, that is 36 right now, right? I believe it's 36. What's important to understand about COVID is that COVID doesn't actually honor the boundaries of county lines. It'll spread across lots of places. And so we have many, many people who live in Madera and work in Fresno, or live in Fresno and work in Madera, and people who live in Merced and work in, you get the idea. And so what we are doing in terms of our tracing is we're in constant contact with neighboring counties. And for instance, we had an essential business where it was a Fresno County resident who was an employee of that Madera County essential business. So they worked with the case, but when we had a bunch of contacts that actually lived in Madera. So we are responsible then for placing them into quarantine, monitoring them for symptoms to find out, and then if they do develop symptoms, we test them. And so while we have only 38 cases in Madera who are Madera residents, it's really important to watch the case counts of Fresno County, Merced County, and our neighbors to understand what the real picture is. We are watching that very closely and collaborating with them to be able to do good contact tracing for all Madera County residents. Let's see. After going into public spaces for essential needs, should we change all of our clothes after we go home? It is a droplet exposure. So what that means is that it's not in the air in terms of when you just breathe. You need to sneeze or cough or wipe your nose and then touch a door handle. Like it's the wet substances of the mucus and saliva and stuff like that that if it gets on our hands, then it gets on surfaces. And so if you're in a public space and out for essential service and you don't go within 6 feet of anyone else, no, you don't need to change your clothes. If you go closer to someone and they turn and they cough in your direction, yes, it's probably a good idea for you to take your clothes off and wash them. If you brush up against a surface that somebody might have touched with their hand, so there are a lot of factors to that question. It's never a bad idea. And if you have a washer and dryer in your home and you are able to change your clothes, then I don't think it's a bad idea to do that. But I don't think that your risk changes by a lot in doing that. But all of us, I think, feel a little bit better when there are steps that we feel like are in our control to make. There's a tough question on here, and it's, what is your advice for people who live in less than ideal circumstances at home, including abuse and other toxic exposures? I don't have all the answers to that question. My advice is, as much as possible, reach out if you need help. And so we do still have essential programs that are in place to help people. There are hotlines. There are professionals who can help. And so if it's truly a toxic environment or if it's abusive, if you or someone in your family, or if you have friends that are in environments that are really not safe, then I would encourage you to have them or yourself reach out to someone that is safe. That might be your school district, a teacher. That could be someone from Department of Social Services. That could be someone at Public Health. We have a community feedback form. And if you are experiencing something, we definitely want you to reach out and ask for help. And we'll do our very best to provide you help as much as possible. I think what's most important is to not stay alone in the issues that you may be experiencing, and don't leave others alone in experiencing situations that are difficult for them. So be a good friend, be a good listener, but also if it really is a situation where they need help from a professional, reach out and get that help as soon as possible. I'm sitting with a friend from behavioral health. Did I cover that well, Sylvia? Any other advice?
If it's an emergency?
If it's an emergency, call 911. So if there's a situation where someone's safety is really at risk, call 911 for sure. I think that answers the other question about someone struggling with their mental health. I think it's really important for people to unplug from the news. I think be careful about being in situations where you might experience cyberbullying, things like that. I know I'm even experiencing some of that. People are posting some unkind things about public health professionals and sometimes using names, and it's not fun, it's hard. And so I put the phone away and I don't look. I mean, honestly, that's the best strategy. Is if it's toxic and you have the ability to stay away from it, what's good for your mental health is to stay away from those toxic things. So who are those people? What are those situations that do actually provide you with positive affirmation for who you are, for what you're doing, that keep you going and keep you mentally healthy? Gravitate towards those things and feed your mind and your heart with those positive environments as much as it's in your power to do that. And if you need help, then reach out. Another question is, do you have any advice for the senior class of 2020 and on how to make the best of the end of the school year? You know, the end of the school year is this short, very short season of your life. You'll remember it. I look back to the end of my senior year, and there are a few moments that are really indelible in my mind. Most of them did not have to do with the ceremonies. And I know that there's a loss, a real loss in not being able to do many of the traditions that mark, celebrate this important milestone in your life. And it's okay to grieve that. It's okay to be angry that you don't get it. That's okay. You have permission to like feel what you feel about it. And it's not fair. There are lots of people who have had important events canceled, weddings, funerals. It's not fair. It's not okay. And all of us are experiencing some level of that. And I'm sorry that the end of your senior year doesn't look like everyone else's. And the end of your senior year doesn't look like anyone else's. For your whole life, you're going to be able to say, my senior year was the year that we were in quarantine for COVID. And my experience was different. And you're going to have stories to share your whole life about what you did with that moment for yourself. And you have a lot of control over that. You have more control over your life than you think you do. And take the advantage of having a life that's filled with technology and create different moments and memories for yourself. Pick a different tradition. And you can drive that. You don't have to wait for teachers to drive that. You guys have lots of great ideas and brilliant minds to come up with really cool ways to celebrate. And I would encourage you to be creative about doing that in ways that are safe, and really be those people who did things differently. And you'll look back and have amazing stories, I have no doubt. My favorite memory of my graduation was I had a friend who had really, really long hair, and he played in a band, and their band got to play for some event. But he had actually made a bet with a vice principal about something, and he lost the bet and he had to shave his head. And we have all these pictures of the ceremony of shaving his head in the kitchen. And all of that is obviously contact. But what I'm saying is that didn't have anything to do with the ceremony. Right? It had to do with other things that were going on at the time. But those are the best memories that I have for the end of my high school career. And I know that you can make some great memories for yourselves. And maybe it's an opportunity to make some great memories with your family, in addition to your friends, and you have access to your family. But I do have some other advice that I'd like to share, just in terms of, the season of your life and where you're headed. There are some really important tools that have served me in my career that I wanted to share with you. The first one is called Strength Finders. It is a tool that has been in development for over 30 years, and so it's been honed and refined. And what they've done is they've identified 34 different strengths. And every person has a collection of strengths that are more theirs than anybody else's. And it's the combination of those strengths together that create a unique kind of pattern that's just for you. And the thing I love about it is that Strength Finders really encourages people, through the definitions of their terms, to think differently about how they operate. So a strength is something that when you do it, you feel stronger. I don't know if there's an activity that you can think of, and it's probably very different than what other people might enjoy, that when you do it, you're like, yeah, I feel great. I want to come back and I want to do that again. Like, I can't wait until I get an opportunity to do that thing again. That's a strength for you. It likely is something you're good at, and that's part of the reason why it makes you feel stronger. But we can also be good at weaknesses. Weaknesses are something that just make you feel weaker. Like, I can tell you, I'm excellent at doing timesheets. I'm excellent at lots of nitty-gritty paperwork and detailed things. Depending on what it looks like in my frame of mind, it can make me feel stronger. But timesheets never, never, never make me feel stronger. I always feel like, oh, I never want to do them ever again. So I can be good at it, but that doesn't mean it's a strength. I actually do know people who love getting into like reconciling timesheets and stuff like that. We have a fiscal manager that he just loves that stuff. And at the end of the day, he just can't stop talking about it. And we all kind of marvel at the fact that he really feels stronger at stuff that makes us like, no, thank you. And so the Strength Finder assessment, you can go online and find it. I think it costs $10. You can also order the Strength Finder 3.0 book on Amazon, and it has a code for you to be able to take the assessment. And the cost is about the same, so I'd go the Amazon route. I haven't had anybody who took that assessment who didn't pick it up and read it and go, wow, how do these people know me so well? And knowing yourself and who you really are and who you're created to be is maybe the most important pursuit of your whole life. And more important than the what you do with it, it's who you are and whether or not what you do is congruent with who you are. And so Strength Finder is something I'd really encourage you to do. If I'm operating my strength, I don't need to operate in somebody else's strength. What I need to do is go and find that person, like my fiscal manager, Sean. He loves doing that stuff. So I let him do all that stuff and I don't have to do it. Win-win for both of us, right? So I work in my strength and he works in his, and we're both really happy and we do an amazing job together. And that's really the concept of Strength Finders. The second one that I would encourage you to look into is called the Enneagram. It's a personality tool. It's spelled ENNEAGRAM. There's an institute, an Enneagram Institute. You can do an assessment and you can learn more about what's your type, is what they call it. And there are 9 different personality types. And the way they describe, basically, it's your personality type that you develop in your childhood to manage the stressors and your emotions. And it's been my executive team has been reading a book about this and really talking about our Enneagram types. And it has been really enlightening for us about understanding our motivations for why we respond in certain situations. And knowing ourselves really does help us make different decisions as well as appreciate the decisions that we've always made. The book that we're working through that has been the best that I found so far about the Enneagram is called The Path Between Us. It doesn't just talk about your own type, it talks about how your type interacts with other people and how those relationships work, which is so productive in your personal life and at work alike. The third thing that I wanted to talk to you about in terms of developing in your career is here I am, a director of a public health department, and I didn't even know what the Department of Public Health did in Fresno 8 years ago. And I'm 45, I'm mid-career, and I'm leading a department that I literally had no idea what they did just 8 years ago. I got invited into that environment. I learned very quickly, and I had a skill set that was for a particular piece of it. But I think that there are lots and lots of different careers out there. There are lots of jobs that are out there. And most of them, like people say, what do you want to be when you grow up? And we go through the standard list. Do you want to be a teacher? Do you want to be a doctor? Do you want to be a lawyer? Like that's just scratching the surface of all the different kinds of jobs that are out there and careers that are interesting and fulfilling and can use your strengths. And so what I encourage you to do, because contrary to popular belief, YouTube does not hold the answers to everything. Find people who are doing interesting things and ask them if you can shadow them for a day. And go and shadow a whole bunch of different people and observe how people work and what kinds of things they do that appeal to you and what's interesting to you. And cast your net really wide to understand what's out there and what you might do. This is a season of your life where you've got so much opportunity. Don't squander it by narrowing your path so much that you don't explore a little bit. Take a little bit of time, take some general ed and shadow some people before you figure out the rest of what you're going to do. Now, you may be someone who is so purpose-filled, and I'm a woman of faith. You know, you may really feel like you have a calling to a particular thing. That's awesome. If you know that at this age, amazing. And it doesn't hurt to learn about other things as well, as certainly to appreciate what other people are doing. The other piece of that is that I've noticed that many young people and young professionals make a lot of assumptions about the best pathway to a particular career. I had a young woman come to me when I was working in Fresno, and she had already gotten halfway through a degree program, and she had a very specific goal of what she wanted to work on. And what I said to her was, well, I'm the only person in all of Fresno County who has a grant to do what you're talking about. And I am not interested in anyone with that degree. That's not what I'm looking for. And she was like, oh no. And she had already gone through half of the program, but she didn't ask any questions. She didn't go to any of the professionals to find out, what do they actually want? What do they need? What degree program do I need to actually do that work? And so ask lots of questions of the experts and don't make assumptions. Don't just do Google searches. It's not going to give you all the information. There's a lot of nuances to how to do things well. And finding good mentors and people who can guide you is so important. It's important for you to pick the best path for yourself, but it's also important just to have that support and to be able to talk through really your personal strengths and passions and what you want to do, and have that person help you process that through. So we have a few minutes left. Do we want to open it up to any other questions?
Do you guys have any questions?
I have one. How did they name it Corona, like after the sale of alcohol without copyright?
So coronavirus is actually a whole strain of viruses. So the coronavirus was named, I don't know which timing happened, but I don't think it had anything to do with the copyright of the beer. And I understand that actually Corona beer has now stopped making Corona beer because of the connotation. I thought that was a bad move, just because I think they could have done some interesting advertising around that and had some pretty good sales.
How would you speak on the anti-protest or on the protests against quarantine, where everybody's talking about like getting together and saying how they want to get outside?
Right. I think that we're in a really difficult spot right now. We don't have 100% of the science that we'd like to have to give us all the answers about what's really happening. And we're working as fast as we can, as hard as we can to get us to that place of having all the information. What I said on a call last night to the state was, we're at a place where for many counties, because we're not LA and we're not San Diego and we're not Riverside and we're not Santa Clara, where there's been lots of cases and it's a different situation. Like, we're actually pretty well situated in Madera to be able to open up businesses. And so what I said to the state was, we need to really have a tailored plan that allows certain parts of our state to be able to enter into phases where we're opening things up sooner than other places. And that needs to be locally driven by data, by preparedness, in collaboration with leadership from counties and cities. And Madera's in a good place to be ready to take steps forward with opening up as soon as the shelter-in-place order is lifted. But it's really important for people to understand the state law supersedes local law. So while the shelter-in-place order is in place, we can't violate that. We can be more strict than the governor, but we can't be less strict than the governor. Did that answer your question?
So what you're basically saying is we can't really go against anything that the government has or the governor has declared for the whole state, even if we're in a better position, correct?
He has to lift the order. So a health officer order is actually enforceable by law, and shelter in place was a state health officer order. Our health officer is Dr. Sonia Angel. It's based on her license, her medical license, that order was put into place, and it becomes law of the state. And while that law is in place, local law can't violate it. And so when they lift that law, they're probably going to put other health officer orders in place that put different kinds of limitations. And we don't know what those look like yet. So we're preparing with flexible plans to see what health officer orders get put in place when shelter in place is lifted.
Okay. Thank you.
Any other questions?
How has Madera County reacted to this coronavirus?
So the Office of Emergency Services is something that is in every county, and that office is responsible for managing emergencies, as the title would imply. So OES is what will do it. In different counties, the structure is set up in different ways. In Madera County, OES is located in our sheriff's department. So the sheriff is the director of our Office of Emergency Services. And very early on, when we saw that there were health officer orders, if you think back a month and a half ago, there were those early orders about limiting gatherings and things like that. And we saw what was happening in China and other countries. And the sheriff and I, because we are the department who is in charge of the event with regards to the actual virus and the response, the science, the expertise with regards to that. We partnered very early with the Office of Emergency Services in a unified command. And so he is an incident commander and I'm an incident commander, and we manage the event together. In our public health facility, the sheriff's deputies are here, and we are very integrated in our response. Incident command system is a system that's used across the entire country to manage emergencies. It's the same no matter what kind of entity you are. So whether you're at a fire department, you're a law enforcement agency, you're public health, we're all trained in the incident command system. So there's an incident commander, there's a planning section, there's a logistics section, there's an ops section, there's a PIO, a liaison, safety officer, and the roles, the position descriptions for those roles are the same no matter what the event is. So there are chiefs in those sections, and then they have teams. In those teams, we have both sheriff's deputies and public health people working. So when one of the sheriff's deputies is like on the fires, he is the guy who is great at logistics. He chases down those resources and finds them. So working with public health and our public health laboratory, they're all working on logistics with regards to testing. So our laboratory did a lot of the background investigation about who's the sales rep, how do we locate it, what are the specifics of how do we get more modules for our equipment, how do we get the cartridges, and then it was passed to the sheriff's deputy, who's really that kind of tenacious bulldog who hounded the sales rep until we got the cartridges approved. So those are the kinds of things that we're doing. I think the biggest effort that we've invested into is rapid contact tracing. We have a sophisticated algorithm for rapid contact tracing that is being recognized statewide as a standard to follow. And so when we had our first case of community spread, we had identified and contacted 150 contacts and got them into quarantine in 24 hours. There was a total of 200 by the time we were done, and that was accomplished within a few days. And so that's been our best practice we've been able to share with others. Other local health departments have areas where they're really shining and they're sharing with us. Now we're moving into a season where Madera is really ahead of the game with regards to preparing for opening businesses and what that would look like and how we would roll it out. How are we going to communicate around that? We have lots of plans in place to be able to roll that out as soon as shelter in place is lifted.
Okay.
I'll take one more question if anyone else has a question. Sarah, I like the spelling of your name.
Thanks.
Director Boss?
Yes.
Could you just real quickly, as you're kind of wrapping up, kind of give an idea for the students as to how much your life and your job has changed since coronavirus became big and COVID started to happen? And once again, thank you very much for your time.
On a regular day, I'm a pretty busy lady. I have lots of different pieces in the Department of Public Health. If you go and you look at the vision and the mission, we actually have more than 45 distinct programs and funding sources that we work with. So we have 100 staff. I do personnel management and budgets and work with a lot of other entities. There's a lot of work collaboratively with other community-based organizations, city government, businesses, and things like that to promote different efforts that we have. For instance, earlier this year, we worked with the city to pass a smoke-free parks ordinance through our tobacco program. And so I ended up being involved with that, both in terms of coaching staff, providing leadership, but I do a lot of like securing funding, working with the state around statewide direction for various programs and things like that. On a regular day, I can honestly say I have excellent work-life boundaries. I know what I can manage, and I don't say yes to too many things. I'm an ambitious person, and I like pursuing and pioneering in what it is that I like to do. And so I tend to take on new projects and really like kind of doing those things that are on the cutting edge of what's going to help people be healthy. And when I go home, I get on the treadmill for half an hour. I'm usually there, right after work. I get to the office at 7:30, and typically I head out a bit before 5 to miss traffic. And I don't typically work from home very often. So I know how to manage that. And part of how I manage that is by delegating well. I don't micromanage. I invest and give authority to my managers to be able to guide and do things. Being the director doesn't mean you do all the work. It just means you know what's going on and you're helping other people and making sure that they have the tools to be able to get the job done. So what's changed with the COVID response is that there's a lot more work that has to be done now. And it's not something that you can kind of timeline out. Like the governor's making the announcement this afternoon. We have to be ready. We have to have it in place, and it just is. So there are times in which I work 14, 15-hour days, and there's a lot of I don't see my family that much, to be honest. And that's the nature of this season. It's not every season, it's just for this time. It's also kind of a different work pattern. I'm often by myself on a normal day, a fair bit of the day. Right now, I'm never by myself. And when I got to the office this morning, I had 2 people waiting at my door, ready for answers for the next thing. And on a normal day, it's a pretty steady stream of people asking questions. Right now, there's almost no downtime to think about something else before the next thing comes up. And so it's a different pace. It's not a pace that anybody could maintain for forever. And I'm mindful of that. But we are very mindful in this to kind of identify times in which we can give people full days off and rotating staff around. So we have a safety officer who's monitoring whether or not people are taking breaks, going on walks, doing things that are important for keeping up our productivity, but also taking good care of ourselves. And they check in on me. They make sure I'm drinking water, all of those things. So I do feel a little bit like I've got a bunch of people who are watching me and taking care of me. It's nice.
Well, thanks again, Director Bosse, and thank you, students. Please, as I always say, take care of yourselves, take care of your families, and stay healthy. And thanks again, Director Bosse. I hope this gets better, and I appreciate your service and definitely your time today in your otherwise very full day. Thank you, guys.
It's my pleasure.
See ya.
Thank you. Bye. He